So, new patients to our clinic will get a welcome email from us, which will have everything included in it. So, in case you forget what I'm saying now, but essentially, the important things are that if you see an optometrist regularly, you should bring the referral in. Um, so, if you've got any previous refractions or previous scripts for glasses or contacts, we need to have evidence of those because one of the key things with laser is we need to have stability of script. And then the other thing is if you're a contact lens wearer, depending on the type of contact lens you wear, we want those out of your eyes at least 48 hours before for soft contacts and longer for hard contacts. So we'll give you an indication of that because contact lens wear can influence the results of the scans that we do. And it's really important that we try and have very accurate scans for the workup. So contacts, scripts, and any referrals. And then you should be aware that when you come to the clinic, you'll be dilated. So that process usually takes about 15 minutes for dilation. So that's where we put a drop in your eye and it causes the iris to become a bit bigger and it makes your vision a bit blurry. And the reason why we do that is not to put you through torture, but just to check the back of your eye to see if that's nice and healthy. So if you're a diabetic or just anyone, and we can also assess if you've got a cataract, because if you've got a cataract, we wouldn't recommend to go ahead with laser surgery. That might be a better option to do the lens-based surgery that I was talking about earlier. So the dilation is important. And the reason I mention that is the drops take a little bit of time to wear off. So usually about 1 to 2 hours. So you usually need to be able to stick around for about 1 to 2 hours after the procedure or have a chaperone that brings you and takes you home. But aside from that, that's pretty much all you need to do. And then we'll sort out the rest for you. So at the consult, we'll do all the scans. We'll assess if you looks like you're suitable in the preliminary phase. And then if you is, then the next step would be to see me or one of our other refractive surgeons. We have a few at Eagle Eye Surgeons. So, and then we would do a more thorough workup, and then we actually talk to you about the procedure in depth, and you have an opportunity to ask us whatever questions you want to ask as well.
Okay, so that's the initial point of contact, and then
Yeah.
so I guess the next stage would be to actually book in for
Mhm.
surgery, and like typically like how far ahead are you booked up for that type of thing? Can I get it
Yeah,
done pretty quickly or?
usually there's about a month of waiting, but we can sometimes fit you in early if we need to, or later if we need to. But there's usually about a month you can expect for laser-based procedures. For lens-based procedures, it's a lot longer because you're relying on external hospital time and space. So our lens-based waiting list is much longer than our laser-based because our laser-based is actually inside the clinic, which is great. So it's really easy for patients. They can just come in the same place where they were worked up. They've already met all the staff. Our laser suite's on site, so it's very familiar on the day of surgery. And it's also very quick. The procedure itself is only about less than 10 minutes per eye. So the actual surgical time is quick on the day. So as you can see, it's a very convenient and easy way to have this problem fixed. And it's a little bit less involved than if you need to go to a private hospital.
So I guess I'll call out the elephant in the room. Is it painful to get the procedure done?
We ask that question to our patients all the time, and the procedure is not painful at all. So the eye is numbed. So we put some freezing drops in the eye, and that basically numbs the eye. It doesn't mean that you can't feel tactile sensation. So you can still feel, what we call the speculum. So this is a little device that keeps the eyes open so patients can't blink during the surgery. So you can obviously still feel that going in, but you shouldn't experience any pain at all during the laser procedure. It's a painless procedure. And we have processes in place where if patients are feeling particularly anxious or, for whatever reason, we have processes and protocols in place and things that we can do for our patients to make them feel more at ease. The pain really, I don't know if pain's the right word. I think after the procedure, when you go home that night, you may feel a tiny bit of discomfort, like people describe it as a foreign body sensation. So kind of like if a bit of sand was in your eye, if you're over at the beach and you got a bit of sand in your eye. And that usually lasts for a few hours. And you usually go to sleep that night. And by the next morning, patients come into our clinic and it doesn't look like they've had surgery. So their eyes are white, the foreign body sensation is pretty much gone. And no one ever complains to me of pain after PRESBYOND. Like maybe some slight discomfort that night at worst. But it's not meant to be a painful procedure because the eyes are numbed, and we're talking about like the incisions we make and the surgery that we do, it's all pretty delicate and refined. So it's not yeah, that's not really a real issue that we have.
And how long does the actual procedure take, like the surgical part of it?
So, like as I mentioned before, it's less than 10 minutes per
Mm.
eye. That's not actually the surgery, like the actual surgery. That's more
Yeah.
just setting up. So we have to put the speculum in and clean the eye, numb the eye up. There's actually two lasers involved with this procedure. So the first laser, which is the Visumax 800, so that's the latest laser on the market from Zeiss, that creates the flap, and that flap is extraordinarily quick. You're talking like 6 seconds, 5 seconds. It's very quick to make that flap. And then we actually have to then move the patient. So the two lasers, there's a mobile bed in the middle of the two lasers, which actually just moves over, it swings over. And then we need to do the excimer laser, which is the laser that actually treats the refractive error, but also has this Presbyon profile to treat the near vision loss. That process is on the second laser. So after we've done the first laser, then the speculum has to go back in. I lift the flap surgically with some surgical instruments, and then I apply the laser to the eye, and then I put the flap back down. So actual surgical operating time is very, very minimal. But the whole process is probably about 10 minutes per eye by the time we're putting, speculums in and out and moving between two lasers. So patients do like the fact that it's quite quick, which means that, you don't have that long to kind of get too anxious about it. And then after the laser has finished, the patients then within our clinic will be moved back to my room, which they've already spent a lot of time in. And I usually assess them under the slit lamp just to check that everything looks good. So the slit lamp is actually here. This is like our little microscope that we look at the positioning of the flap, make sure I'm happy with that. And then the patient will just make their way down the corridor to our recovery area. And they'll usually stay there for about 10 to 30 minutes, depending on how they're feeling. And then they can go straight home after that. But on the surgery day, they do need to have someone bringing them to and from the surgery because we're operating on both eyes. And the vision will be a bit blurry the day of surgery, and that's just expected and normal.